Hello, welcome to Core Medics. We are going to again introduce another fantastic case and what we kind of do here in the clinic. And so I'm here with Dr. Robbins and myself, Dr. Hill, and let's go ahead and dive right in. Let's talk a little bit today about knees. What can we do with knees?
What can we do with knees? Well, I would say that knees, doc, are probably the number one type of case that we get for folks that are looking for answers. We get all kinds of knee patients that come into the office that have been told, number one, I've been told I need to have my knee replaced. Number two, I have bone on bone. And so we get a ton of knee pain patients that are looking for options besides having their knee replaced.
Wow, I think it's 900,000 knees replaced last year alone.
Something to that effect. Yeah,
That's
I think they run. We've heard varying amounts, but $60,000 to $70,000 to have a knee replaced.
yeah, very expensive. Very. Tell me a little bit about. So I know that when we're dealing with a knee replacement, there's time that you need to take off. There's time that you're looking 6 to 8 weeks that you're gonna have to take off work and so on and so forth. And there's rehab. There's motions. There's a lot of work to be done after the knee is being replaced.
Right.
Tell me a little bit about, is there any time taken away when we're dealing with rejuvenation medicine
Sure.
in these?
So when a patient comes in, if they're a candidate to do a regenerative cell therapy program, first of all, it's just a single injection. And so it's simple, it's quick. Sometimes they'll recommend some therapy afterwards. And the doc is going to definitely tell you, Dr. Black's our medical director of our regenerative medicine department, and he's going to tell you that you need to take 30 to 60 days to kind of take it easy. But it's not the kind of taking it easy that you're going to have. If you have a knee replacement, you can barely be up on that thing. I mean, you're going to be bedridden for a little while, and then they're going to start getting you up. You might be on a walker, and then you're going to be with a cane, and then you're going to work your way through that. With this, I mean, you drive yourself home. It's a single injection, and then you're just going to have to take it easy. We don't want you walking up and down 30 flights of steps. We don't want you going out. We had one guy when we first got started in this. We told him to take it easy, and he went out and hiked on the Appalachian Trail for a couple of days.
Must have been feeling better.
It must have been something, but it didn't go well because he damaged those new tissues in there that we were trying to grow. And so, what happens with regenerative medicine is we inject stem cells that come from the umbilical cord of a healthy born baby. And so, these building blocks that your body needs to fix that cartilage in there that's been damaged. Basically, if you get in there and you really work it, you're down on your knees, you're doing a lot of bending, you're going up and down stairs, those joints are it's going to jam together, and it's going to probably kill a lot of those cells. And so we just want patients to take it easy after they've had this procedure, but very shortly, within 2-3 weeks, they can start going back to regular daily activities. And most of them find that daily activities are going to change because it's going to be a lot easier. They're going to start to have pain relief. They're going to start to see better range of motion. They're going to start to see that their knee doesn't want to give way like it did. And so, it's pretty exciting stuff.
Awesome. So what is going on when on a day-to-day basis, once you get the injection and you're resting, are they multiplying? Are they, what exactly are they doing?
That's a great question because so what we know about stem cells at this point, and it's a rapidly changing field. It's only been available in the U.S. for about 4 or 5 years, and so it's been in Europe for 20 years, but we're a little slower on the uptake. But what happens is that cell after 28 hours, that cell splits and divides, and now you have 2 stem cells. And then after 28 hours again, it does the same thing. So now you have 4, and then 8, and then 12. And so they tell us that if you start off with about 1 million stem cells, which is what is in a 1 cc injection, which is about that much in a syringe, that by the end of a month, you have 1 billion cells that are in there growing and repairing the damaged tissue and creating new cartilage tissue. So, if you're giving those cells good nutrition, nutrition plays a huge part. We put our patients on an anti-inflammatory diet just for a short time. Sometimes we'll send them home with a therapy device to use at home that will increase circulation. But those are some of the things we have them doing while they're at home.
Why is it important to do an anti-inflammatory diet, and what does that mean?
Sure. So highly refined foods create inflammation in your body. The standard American diet, some people call it the SAD diet, it creates an inflammatory response in the joints, and it makes your joints ache. It makes your joints hurt.
Yeah.
And so your body can't process all those toxins And so if we can get some of those toxins out of there, if we can get some of the inflammation out of there, it's going to help your body heal. And most of the time we talk about not only anti-inflammatory, but just keeping your blood sugar, instead of it going up and down and up and down, we keep your blood sugar level. The stem cells tend to grow better when that blood sugar is on a level basis.
Absolutely. I even tell my patients that when you sprain your ankle, you're told to elevate, ice, and rest, right? And so what's the importance of that? Well, the ankle will swell. And so they tell you to put that ice on there because you want to bring that inflammation down as quick as possible. But what's the point of that? And that is because the body does not release growth hormone to that area. So if the swelling is there, it will slow up your healing process. So in the same manner that if you're eating sugar refined foods, you are going to cause inflammation systemically in the body. So you are going to suppress healing in your body. So this is why the SAD diet, aka the American diet, is so detrimental, and it's creating our bodies to slow the process of healing, and it suppresses your immune system. So
Yeah,
that's
exactly,
great.
exactly. So if you're at home and you're struggling with knee pain, if you've been told you have to have your knee replaced, you've got bone on bone, you have no other options. I was actually one of our first patients, and I was told by a fellowship trained, board certified shoulder surgeon that I really had no options, that I had 2 torn rotator cuffs, 2 torn labrums, and grade 4 arthritis. I just needed to retire and have my shoulders replaced. And I decided to look at other options out there because I was too young to do that. Um, I was able to, with just a single injection, to change my whole story. I couldn't take my shirt off by myself. My wife was helping take coats off, and so I can do whatever I want with my arms now. If you're sitting at home and that's your story, and you're just struggling, you don't have any hope at this point, you don't know what to do, you really don't want to go through this major surgery. We offer a way to get in and get seen. It's called a discovery visit. Doc, can you tell them about a discovery visit?
Sure. Discovery visit is basically kind of describes it in the name. We wanted you to come in and have a way to kind of get your feet wet a little bit in what we do. And what we do there is that we take a film, and it's just a one-shot film in an area of the complaint. We're going to look at the complaint area, and we're going to get medical to look at it. Team of doctors, the team's going to look at the case and say, hey, is this a candidate that we need, that we can help? If not, we have no problem to say, listen, we'll get you the right place here, but we want to just be upfront with our patients, and we want to make sure that we get them the hope and they get the treatment that they can. And so Doc has such an amazing story, and it's just funny to hear the story over and over, because I've been working with him now for about a month here, and the patients that in the volume that he's seeing, you can't even tell that he's had a shoulder issue or that he's had a hard time putting even a shirt on when he's sitting here and doing what he does.
Yeah.
On a regular basis. So if you're hearing this right now, and this is just really, kind of getting you stirred up, don't hesitate. The longer you wait on things, the more time that is advanced, we want to come and help you. So when you sit there and you wait too long, that's where the problem happens. So give us a call. Core Medics, 434-797-4455.
Thanks.
Thank you.